Alcohol abuse is responsible for over 5% of all deaths and is the fourth leading cause of preventable death worldwide. Alcohol addiction is considered a mental health disorder. It can lead to physical and psychological dependence. A person with a physical dependence needs alcohol for their body to function. Those with psychological dependence cannot stop themselves from drinking, no matter what the consequences are. Alcohol addiction goes beyond regular drinking. The short-term signs of alcohol addiction can include consuming larger amounts of alcohol over time, spending more time and money on getting alcohol, frequently being hungover and showing signs of intoxication like slurred speech and walking problems. Smelling of alcohol or empty bottles all around the house, an increased risk of injury from falling or risky behavior, decreased self-care and poor hygiene and weight changes. There are also emotional signs of alcohol addiction, like rapidly changing moods, increased irritability, failing to follow through on responsibilities and anger and aggression. Problems with memory, concentration and attention, hallucinations or delusional thinking and new or worsening anxiety. The long-term impacts of alcohol abuse can include a weakened immune system, cardiac issues, like high blood pressure and irregular heartbeat and liver problems like fatty liver, hepatitis and cirrhosis, and pancreatitis and cancer. Alcohol abuse can also affect relationships with family and friends. This can mean spending less time around friends and isolating, spending more time in new and changing social groups and increased lying and deceit. Failing to follow through on plans, increasing conflicts with friends, family and coworkers and problems in school or work. Drinking too much at one time can also lead to alcohol poisoning, a serious and sometimes fatal condition. Signs of alcohol poisoning can include nausea and vomiting, slowed breathing, slowed heart rate and unresponsiveness. If you suspect that someone has alcohol poisoning, call 911 immediately. Some of the most common risk factors for alcohol addiction include binge drinking and heavy drinking, genetics and a family history of alcohol problems and drinking alcohol before the age of 15. Mental health conditions and traumatic experiences. Over 25% of adults have reported binge drinking within the last month, putting them at risk for addiction. Alcohol use disorder can co-occur with many mental health conditions, like depression, anxiety and antisocial personality disorder, bipolar disorder and schizophrenia. There is hope in professional treatment for alcohol addiction and alcohol use disorders. A comprehensive rehab treatment facility will offer medical detox and inpatient rehab, with supervised around-the-clock care. Then you will step down to transition levels like partial hospitalization and intensive outpatient, followed by outpatient rehab and aftercare support. The most important step to recovering from alcohol addiction is seeking treatment. The Recovery Village can help. Our facilities offer high-quality, comprehensive treatment that's personalized to fit your needs. Call our recovery advocates today at 855-239-9898 and get your life back.